Okay, good morning, student. Do you still remember what we have discussed yesterday? Whatever we have discussed yesterday? Srijana, what we discussed yesterday? That's the topic.
Ma'am, what happens in the pregnancy, UTI, and treatment
Okay.
complications?
Okay. Is the screen visible? Yes or no?
Yes, ma'am.
Okay. Okay, long jump and this person is joining now. Okay. I think we have already discussed this, right? The complications. Okay, today we will be starting with this chronic renal disease. Oh, here the spelling typing. Okay, no problem. This chronic renal disease means we have already discussed about this, right? What was the definition that I have given you during your offline class? Ilasara, what was the definition that I have given for chronic renal disease during your offline class?
Chronic renal disease is also known as chronic renal disease. It's a rapidly progressive deterioration or loss of renal function in which the
Okay.
body's ability to maintain metabolic and fluid electrolytes balance fails, resulting in uremia or azotemia over a period of months or years.
Okay, very good. Um, whom will I ask? Rudolph, what was the other name of chronic renal disease that we have already discussed? What was the other name of chronic renal disease? Rudolph, what was the other name of chronic renal disease? Rudolph, let us not waste time. You know or not? If no, I'll ask other. You know or not, Rudolph? If no, I'll ask other. Rudolph, are you there? Okay, no problem. Samuel, what is the other name of chronic renal disease? Hurry up, we'll continue first. End stage renal. How do we write in short? How do we write in short? Shirley, how do we write in short? Okay, Srijana, tell me, how do we write the other name of chronic renal disease in short?
ESRD,
Yes, what was the full form of that?
end-stage renal disease.
Okay, very good. So today, like this chronic renal disease, like it also like affect pregnancy. Okay, that is why we will be discussing again here. We will not go much detail about this because we have already discussed about this topic. Now, what does it causes, what it affect in pregnancy, only that we will be discussing today. So the most common cause of chronic renal disease that we find in pregnancy is diabetes mellitus. In short, I have written DM, that is diabetes mellitus. This diabetes mellitus is the most common cause of end-stage renal disease, and it accounts for women 33%. Like it's 33%, it accounts for 33%, is common in 33% of women. So this diabetes mellitus, it is the most common cause. So you can just write it down that what is the most common cause of end-stage renal disease, diabetes mellitus. And the next is like hypertension. Hypertension is also the common cause of chronic renal disease, and which account for 25%. And after that, GN. What do you think the meaning of GN? Anyone? I have already discussed and told you all the meaning of this. GN. GN. What is GN? Okay, let me give a hint. Anyone?
Glomerulonephritis.
Yeah, glomerulonephritis. Okay, glomerulonephritis, right? Okay. Ishan, what is glomerulonephritis, which I already discussed before? Glomerulonephritis. जो तीस में जो N होता है, that I already said ना. That will
Ma'am,
be
inflammation in the glomerulus.
yes, very good. The inflammation in the glomeruli is known as glomerulonephritis. All of you who could not answer this, you just write it down the meaning. You keep on writing because I keep on repeating. You keep on repeating writing so that you will never forget in life. So GN means glomerulonephritis. And these also account for 17%. And this is also the another cause that led to chronic renal diseases in pregnancy. And the other one is polycystic kidney. Polycystic kidney. This polycystic kidney disease, this also account for 15%. Have you ever heard the term polycystic kidney? मैंने सिखाया था ऑफलाइन क्लास में, थोड़ा बहुत बताया polycystic का मतलब, cyst का मतलब भी बताया था मैंने. What is polycystic kidney? This is also the one of the, you know, the main causes of like chronic renal disease that affect like the woman during pregnancy. So you should know this polycystic kidney. Any idea? Cyst क्या था? Cyst. I still remember during your offline class in your classroom, there was a diagram of the kidney. There was the normal kidney. And then how does cyst occur? I already explained this. See this, what is this? This was our healthy kidney, is not it? So cyst क्या होता? Cyst, so it was a like non-cancerous, you know, it is a round sac that contain fluid. ऐसा round sac mass का जैसा जो formation होता है. I already explained this. This is your non-healthy kidney. This is your polycystic kidney. And cyst का मतलब है it is a non-cancerous round sac containing fluid. ऐसा होता है. This is how. Can you differentiate now the differences between our healthy kidney and polycystic kidney? Yes or no? Hello, yes or no, student?
Yes, ma'am.
Oh, okay. This is the difference. And so that polycystic kidney disease, that also like it accounts for 15%. And these are some of the, there are so many causes of chronic renal disease, but some of the like common causes, I'm just mentioning all these. So what were the causes? Diabetic mellitus, which account for 33%, hypertension, which account for 25%, glomerulonephritis, 17%, and polycystic kidney, which account for 15%. तो glomerulonephritis ये जो है, this is the inflammation of the glomeruli, right? So what is glomeruli? What is glomerulus or glomeruli? Srijana, what is glomeruli or glomerulus?
Maybe it's a blood of capillaries.
Yes. It's correct. Okay, means like you can simply mention like this also, like these are like what to say, the tiny blood vessel. Okay, the tiny blood vessels, like, or the filter that is present inside the kidney. And what does this glomeruli do? It remove the like the excess fluid, electrolyte, and the waste product from your bloodstream. Understand? Whatever fluid, electrolyte, or any waste product, like excess waste product that are like present in your bloodstream. The glomeruli will remove all this, and after removing, it will pass into your urine. That is known as the glomeruli. And then what was this diabetes mellitus? What was diabetes mellitus? Diabetes mellitus क्या था? शीतल, diabetes mellitus क्या था? शीतल, डायबिटीज मेलाइटस क्या था? क्या का लेवल हाई होता था? शीतल, स्लीपिंग?
No, ma'am.
ओके, डायबिटीज क्या था?
Blood sugar बहुत high होता है वो.
Yes, it's correct. If you know the answer, like don't hesitate. Okay, it's correct. Like diabetes mellitus means like you can simply call it as the high level of sugar, जो glucose है ना, that is very very much high in the blood, that is known as diabetes mellitus. So ye chronic renal disease ka agar, if a person like a woman suffer from diabetes mellitus, you have a great chances of developing this chronic renal disease. And these are some of the common causes. Now coming to the renal impairment, like it can also lead to like renal impairment. Okay, this chronic renal disease, it can also lead to renal impairment. So this impairment, how will it occur? The impairment might be mild, the impairment might be moderate, the impairment might be severe. So mild impairment ka matlab kya hai? Mild impairment means if the creatinine level is less than 1.5 milligram per deciliter, then it is termed as mild impairment. Mild means not that much severe impairment. Okay, थोड़ा सा जो impairment हो रहा है ना, kidney का थोड़ा सा impairment means dysfunction, that is termed as mild. That is if the creatinine level is less than 1.5 mg per dl. And coming to the next is moderate. Moderate means if the creatinine level is between 1.5 to 3 milligram per deciliter, then that is termed as moderate renal impairment. And again, what is severe? Severe means बहुत ज़्यादा severe, बहुत ज़्यादा dangerous, like impairment. कब होता है? जब इंसान का creatinine level, if it is more than 3 mg per deciliter. DL means deciliter. So this is how the renal impairment occur in the pregnant woman. All this during exam, if I give the renal impairment, means in mild impairment, how does this mild impairment takes place? Then you have to write if the creatinine level is less than this, and how this moderate impairment occurs. Then you have to write it is when it is between 1.5 to 3 mg, and if it is severe, you have to write if the creatinine level is greater than 3 mg per deciliter. You understand about chronic renal disease? The causes and the renal impairment? Yes or no?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Okay, let's move on. Okay, what are the complications that you will find means in a chronic renal disease? Means a woman suffering from a chronic renal disease during pregnancy, what type of complications she will be facing? So let us see. First of all, number one is there will be a 15% impaired renal function. Means kidney का जो function है ना उसमें impairment होगा कितना 15%, it will account for 15%. Again 50% worsening proteinuria. Proteinuria क्या था? Proteinuria क्या था? Shirley, what is proteinuria? Shirley, what is proteinuria? Because we have mentioned in the second point that there will be 50% worsening proteinuria. So proteinuria.
High level of protein in the
Where?
urine.
In the?
In the urine.
Okay, high level of protein in the urine. Is it correct, Samuel?
Yes, ma'am.
Okay. Then that means like 50% worsening of proteinuria. This also will be the complication of chronic renal disease. And then 12% hypertension, and then 50% which 50% which account for like complication related to hypertension. Means like 50% of them will 15% of them will have like impaired renal function. Okay, and then 50% will have worsening proteinuria, and then 12% will have hypertension, and the 50% will have complication that is related to hypertension. And then okay, coming to the next one is like dialysis during pregnancy. Means during like dialysis is like consider, dialysis is considered like to be the, what to say, like when the, like to be the what to say, to be the like management of those women who suffer from like end stage renal diseases or simply chronic renal diseases. क्योंकि हमारा जब kidney function नहीं अच्छी तरह नहीं होता, and then when our kidney is totally damaged, okay, then what do we do is that we go for dialysis, isn't it? So dialysis, वहाँ पे dialysis used to act as an artificial kidney. Like before, our kidney used to do filtration and all, na, but now our kidney is damaged, so it can't do all those things. So what happened is that they go for dialysis. So dialysis, once that even the dialysis, like the women, like some of the women, when if they have kidney failure, they totally depend on dialysis, okay. But what happened is that you can do, when dialysis does not work anymore, then you can also go for kidney transplantation, which we will be discussing after this. So dialysis during pregnancy, it accounts for when the creatinine level is 5 to 7 milligram per deciliter. Means like when the woman's creatinine level is okay, if it is 5 to 7 mg per deciliter, then it undergo dialysis. So next is increased pregnancy loss and SB and PTL sepsis. Means like if a woman suffer from chronic renal disease, okay, then she will have the increased risks of pregnancy loss. उसका pregnancy loss हो सकता है. And then SB means stillbirth, and then PTL means like yesterday I already discussed, that is preterm labor, and then there can be a sepsis, or not all these things, okay. There can also be like IUFT, that is intrauterine fetal death, miscarriage bhi ho sakta hai. Means lots of things can occur here. So what do you mean by stillbirth? Do you have any idea? Like iska complication ka andar mein aata hai na, agar kisi woman ka chronic renal disease hua during pregnancy, तो उसका increase pregnancy loss होगा, उसके साथ साथ stillbirth भी होने का chances है, or preterm labor. तो what is stillbirth? You have any idea? Like still, what is stillbirth? You have any idea? Stillbirth. Any idea? Stillbirth. Stillbirth. You have any idea what
No.
is still? Okay, stillbirth means na. It is the like the fetal death, fetal death at or after 20 or 28 weeks of pregnancy. जो like, or you can simply term as like the birth of an infant that has died in the womb. जब मदर का womb में बेबी जब होगा ना, तब like जब fetal, that is the baby मर जाता है, like fetal died at or at 20 weeks या फिर 28 weeks में, means fetal death हो जाता है, तो that is known as stillbirth. means like delivery होने का आगे जब मम्मी का womb में जब baby होता है ना, तब like the baby used to die, that is considered as stillbirth. So if you want to write it down, you can just write down that the fetal death at or after 20 or 28 weeks of pregnancy is termed as stillbirth. Do you want to write what is stillbirth?
Yes.
Okay,
Yes,
right.
ma'am.
Fetal death at or, you write fast, write fast. Fetal death at or 80, at or after 20 or 28 weeks of pregnancy. Let me repeat, fetal death at or after 20 or 28 weeks of pregnancy. So that is considered as stillbirth. So like जब बच्चा का like 20 weeks या फिर 28 जब हो जाता है ना, like then fetal death occurs. So these are very much like, you know, like means the saddest things for the mother, all this, and this happen because of the complications that occurs in your kidney, that is the chronic renal disease. Because of this complication during pregnancy, all these stillbirth complications all can occur. So it is very much dangerous, all this. And then again, preterm labor, I already explained. And sepsis. Have you heard the term sepsis? Sepsis? Anyone? Sepsis. Sepsis पता है क्या? Sepsis? Anyone? Surajit, what is sepsis? Sepsis. If you know, say you know. If you don't know, you say you don't know. Srijana, what is sepsis?
I don't know.
Oh, okay. So you can just write down, okay, sepsis, because this comes under the complication now. If you just write like this, there will be increased pregnancy loss and stillbirth and preterm labor sepsis. Without understanding the meaning, it will be of no use. So you just write what is the meaning of sepsis. Sepsis means it is the sepsis is a life-threatening organ dysfunction triggered by infection. You can write. It is a life-threatening organ dysfunction. Life-threatening organ dysfunction, 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 trigger by infection, trigger, trigger by infection.
Ma'am,
Yes, yes,
ma'am,
yes,
please
say.
repeat what sepsis.
Okay. Sepsis is a life-threatening organ dysfunction triggered by infection. Sepsis is a life-threatening organ dysfunction triggered by infection. Done, isn't it? Let's move on. Done, isn't it? Yes or no?
Yes, ma'am.
Okay,
Yes,
proceed.
ma'am.
Yes, ma'am.
Okay, let's move on. Now, pregnancy after renal transplant. The renal transplant तो सबको पता है ना? Samuel, renal transplant क्या था? Heart transplantation, renal transplantation, all those. Samuel, renal transplant क्या था?
दूसरा का किडनी को
Donate.
हाँ डोनेट करना,
Okay. You have
जिसका किडनी खराब हो गया उसको डोनेट करना.
okay, you have little bit idea about it. Okay, pregnancy after renal transplant. So now we will be discussing about this. Okay, like a woman. Okay, like a woman is undergoing renal transplantation. उसने renal transplantation किया है. Means pregnancy after renal transplantation. तो renal transplant करने के बाद उसका pregnancy, like उसका pregnancy हुआ. तो what are the what are the changes or what are the difficulties or what are the physiological changes that you will see in a woman जिसका renal transplantation हुआ था pregnancy का like आगे. So let us see. So there will be an increased risk of, again, PTL, that is preterm labor, means LBW, that is low birth weight. Then there will be an increased risk of developing in IUGR. Have you ever heard the term IUGR? Yes or no? If no, say, I'll say the meaning. Otherwise, again, there will be
No,
no.
ma'am.
Okay, IUGR. You can just write down the full form. IUGR, intrauterine growth restriction. I stand for intra. You write down intra, INTRA, intrauterine. You write all together, okay? Intrauterine, U for uterine, G for growth. Intrauterine growth restriction, RESTRICTION. Intrauterine growth restriction. Intrauterine growth restriction. So agar, like, if pregnancy after renal transplantation, means renal transplantation ke baad agar like a woman is pregnant na, so renal transplant ke se agar kisi woman ka pregnant hua na, then she will have the increased risk of this developing this IUGR, that is intrauterine growth retardation. So now, do you want to know the meaning of intrauterine growth retardation? Because it is mentioned like after this renal transplant, the woman will have the increased risk of developing this. So do you want to know what is the meaning of IUGR?
Yes, ma'am.
Means IUGR means how to say, like when a baby is in the womb, okay, and it does not grow as expected. Srijana, please take attendance, okay? The time is very less. You please join again after this. So when a baby is in the womb, it does not grow as expected. Means like the baby is not as big as would be expected, okay, for the stage of the mother. Means बच्चा जितना बड़ा होना था ना उतना बड़ा नहीं होगा. So like that is known as intrauterine growth restriction. So means बच्चा का baby का growth में like retardation होगा. Means growth restriction होगा उसका. So that is known as intrauterine growth restriction. Do you understand, or I need to repeat again? Do you understand, or I need to repeat again? You understand, or I will repeat again?
Yes, ma'am, understand.
Okay, okay.
Repeat again.
I'll repeat. Okay, means like when the baby is in the mother womb, okay, it will not grow as it is supposed to grow. Means it, as expected. Means it was expected to grow big, okay, according to the mother stage of pregnancy. Like it was supposed to grow big, but it won't grow as expected. तो जितना एक्सपेक्ट किया था उतना ग्रो नहीं होगा, तो इसलिए उसको बोला जाता है इंट्रायूटेराइन ग्रोथ रेस्ट्रिक्शन. And then PET is preeclampsia. You can write preeclampsia. Preeclampsia. You can write it as preeclampsia.
Ma'am, spelling.
Pre ECLAMPSIA. Preeclampsia. PRE. You can just write like this, PRE, give dash. PRE, give dash, and you write ECLAMPSIA, preeclampsia. This there will also be like increased risks of developing this preeclampsia, okay? And then preeclampsia means like it is the condition, okay, in pregnancy which is characterized by high blood pressure. Means pregnancy के time पे women का blood pressure बहुत high होगा, and sometimes with fluid retention and proteinuria. So yeah, you just need to know this preeclampsia means during pregnancy the blood pressure of the woman is very much high. So that is termed as preeclampsia. And there will also be like increased risks of pregnancy loss, which is very much bad. And then like and then you have to watch for like infections, and then again diabetes mellitus in immunosuppressed patients. Means like if there is any infection, you have to watch for that. And also like in immunosuppressed patient, okay, there is a chance of developing the diseases, and the diseases like diabetes mellitus. What do you mean by immunosuppressed patient? Immunosuppressed. Any idea? Any ideas, Srijana? You have any idea what is immunosuppressed? Say?
Ma'am, like malnutrition.
Wait, let me explain. Okay, immunosuppressed patient means like, immunosuppressed means what? We have immunity, is not it? To fight for the diseases and all. We have immunity, is not it? Immune system. Student.
जिनका immune weak
Yeah,
हो.
immune system. So immune system का मतलब क्या? Immunosuppress का मतलब क्या है? Immunosuppress, it is an, you know, like it is an क्या बोलो? It is an impaired ability of the immune system. हमारा जो immune system है ना, that will be impaired. It is an impaired ability of the immune system to fight infection or other disease. So like especially these occur in those patients who have any kind of illnesses and all ना, जिसका बीमारी होता है. So like all those immunosuppressed patients, they have a great chances of developing infection. So like these immunosuppressed patients, they will have a chances of developing these diseases like diabetes mellitus. So this is one of the like common like diseases. So immunosuppressed का मतलब do you understand? Or I need to explain again?
Yes, ma'am.
You understand?
Ma'am.
Yes, say. And then rejection.
जिसका immune system weak हो.
हाँ, जिसका इम्यून सिस्टम वीक होगा ना, क्योंकि हमारा इम्यून सिस्टम क्या करता है, जो डिजीजेस, कुछ भी जो डिजीजेस, एनीथिंग ही, वी हैव द लाइक कैपेबिलिटी टू फाइट फॉर इन्फेक्शन और एनी डिजीजेस इज नॉट इट। लेकिन अगर जिसका जैसे कि बीमारी है, मीन्स लाइक उन लोगों का इम्यून सिस्टम बहुत वीक हो जाता है ना, और यू कैन सिंपली कॉल लाइक दिस, इम्यून सिस्टम इज द स्टेट इन व्हिच योर इम्यून सिस्टम इज नॉट फंक्शनिंग एज वेल एज इट शुड। तो जैसा हमारा इम्यून सिस्टम लाइक डिजीज को फाइट करना था, इन्फेक्शन को फाइट करना था, जैसा लाइक फंक्शनिंग होना था ना, वैसा फंक्शन नहीं होगा ऐसा। तो ऐसा नहीं होगा तब if that kind of condition occur, okay, at that time the patient will have a great chances of developing diseases, and यहाँ पे जो mention किया diabetes mellitus. So you understand what is immunosuppressed patient? ऐसा वाला लोगों का जिसका इम्यून सिस्टम फंक्शन जैसा फंक्शन होना था वैसा फंक्शन नहीं होता, उन लोगों को बोलते हैं इम्यूनोसप्रेस पेशेंट। अंडरस्टैंड? यस और नो?
Yes, ma'am. Yes, ma'am.
ओके, you have any question? The time is going to get over. You have any question? You have any question?
No.
Ma'am,
Yes.
what is rejection?
Means rejection means na like after means like there will be a kidney transplantation. It's not it. So like some of the like kidney and all na, after you donate the kidney to someone, means like someone donated the his or her kidney to you, okay, and then like means how to say like how to say like you are not that much like how to say, yeah, you means your body does not respond to that kidney as to how it should respond. Understand? Means that kidney does not fit to you as it was supposed to. So there will occur a rejection ka matlab wo hai. You understand? If not, I will
Yes, ma'am.
explain again. Okay, means like rejection used to occur. But this rejection, it does not occur in many cases, only in 30-20% cases, like this rejection used to occur. So this rejection. And the next is what to do prior to pregnancy. So this one, only this much is left for today's discussion. So after the end of this, just after 10 minutes, you join again, okay? Just I will complete this because I don't want to repeat this again tomorrow. So I'll just complete today. It will take only 10 minutes for this. Okay, please join the class again, okay? I'll end with this. Srijana, are you done for the attendance?
Yes, ma'am.
Okay.